And so I started applying around, and I was marketing myself as a communications person because I thought that was primarily my background. I sent a resume off to Samaritan's Purse, who honed in on the fact that I had done some HIV/AIDS work. And they asked me to come and join their HIV/AIDS team. They had just had an opening. And this was at a kind of exciting time in sort of HIV/AIDS stuff because the President's Emergency Plan for AIDS Relief had just come out, and they were busy wanting to prepare proposals for some big grants, and I got engaged on all of that. And then they also realized that I really loved being on the ground, and so while I was based in their Boone, North Carolina office, I was about 220 days a year on the road, and mainly overseas. And I was with them for a number of years, and then I said, I really want to get a master's in public health. That hasn't changed. And I still sometimes think about the nursing too in all this, but I said, I really want to do this, and I ended up going to Boston University to the School of Public Health there, where I got the privilege of being Davina's roommate. And I kept working while I was there as a consultant for Samaritan's Purse. I did my thesis was actually work on their Niger community-based kind of primary health care program with a focus on child survival. And I got to kind of do work along the way, always being connected with communities. When people overseas, I got to go back to Niger immediately after graduate school. And in all of this, I've been sort of in this HIV/AIDS world, and I was wanting to get kind of back into the roots of the communities that I felt like I was in when I was in Sudan the first time. And an opportunity came up for me, and I went back to Sudan, and this time to Darfur. And I worked in a community-based primary health care program. We were really closely linked with the Ministry of Health. All the clinics in the program were Ministry of Health clinics, and we worked with trying to establish village health committees and trying to establish strong pharmaceutical supply chain and doing monitoring and surveillance of disease and a lot of different things. It was a big, massive program. It was a great thing to be involved with. And somewhere along the road there, I realized that there were a couple of things going through my head, and one of them was that Darfur was a really interesting place to work, and the NGO that I was working in was really interesting, and you'll kind of learn these things as you go. It's a great group. It's Metzger. Both Metzger and Samaritan's Purses are really good places to get started if you want to in public health, I can tell you. But it was a really excellent group to be involved with, but they weren't sort of linked at this community level because they're funded through, you might have heard some of this last night in the session. I unfortunately wasn't here. I don't know what they talked about, but when you get funded through donors, there's a lot that drives kind of your calendar and your year and how you're programming. And so I was kind of thinking through, gosh, what can I do in my career, that I can stay engaged? What would that look like? Would it be, do I need to be back in the U.S. so that I can actually have a sort of job, and then my vocation is more what I do on the side, maybe through church or community, but I was asking myself a lot of questions, and I was trying to think, I know it's not sustainable to sort of be in this NGO world that I was in that was very heavily financed by external donors, and in Darfur where there was a very sticky political situation, actually NGOs often were part of the politics. So I was trying to figure out where all that would be. And I kind of gave myself a timeline that I would come back to the U.S. and take a breather and figure things out, what that would be next. And I was sort of telling myself I was going to do this, and about that time I was talking to an old friend of mine from college, online from time to time, using GChat, Skype, that kind of thing. And it ended up that this friend and I have fallen in love, and that's Rob over there. And so so as I decided to come back to the U.S., that also factored into my decisions. So career path can be mixed in with personal life in a lot of ways. I came back to the U.S. We were not at all sure what was going to happen. And again, he was living in Charlotte, North Carolina at that time, so I came back and sort of landed there. And before I got back to the U.S., two people sort of from my HIV/AIDS world popped back on the radar and told me about job opportunities that I wasn't really pursuing, but just that they were open. And both of them required basically that I send an email and attach my resume. And I sent them sent the email, attached the resume, and both of those jobs they ended up being offered. And one of them is the one that I currently have, the Office of Global AIDS Coordinator. And the friend is Tom Walsh, who's running around somewhere here at this conference if you had a chance to meet him. So my career path has also probably been a kind of, circuitous route. Sometimes I say I kind of stumble into things along along the way. But what I would like to say is just about calling for a minute, if you don't mind. Sure. Like, I think for me there are a lot of little moments on the path about calling. There was the moment when I was with my friend after her child had died, and that was a really critical moment for me. It was a moment where there was actually a part of me that wanted to duck and run, to be in a more sort of safe kind of place where I wouldn't ever have to see the child die of diarrhea. I found it really painful and difficult. There was another piece of me that thought, I will fight this until I die. You know, I don't want to see children die of these things. So I had that kind of competing thing, and I think that was a really critical moment. I think that honing in on vision and calling for me also included moments where I sort of realized, okay, I have a desire to sort of love people and be a part of communities, and a lot of the work that I do from day to day, and a lot of the work that anyone will do from day to day may become administrative, or there might be a lot of reports or things like that. And so how do I keep those connections alive and so that I have a heart engagement? And for me, a lot of that started to be about, okay, I'm going to build relationships with families wherever I live, whether I'm in Niger or in Sudan, you know, build those relationships. Or in Darfur, with a friend, we started a basketball league for high school girls. And they are the two-time national champions for high school basketball in Sudan, I'll say. You know, but that was just kind of a thing where I could be engaged with empowering women and girls, but it wasn't related to my job. It wasn't about grants. It wasn't about the Ministry of Health. It was something that we could do and be involved. You know, at different times in my life, it's been about engaging, you know, international students for a period of time in my life, you know, or different things. So I think sometimes, even when we find ourselves in a job that we love, to keep engaging our heart or our calling, we have to really put ourselves in places relationally where we are able to remember what we're connected to. And I feel so grateful now. I'm in a very bureaucratic role. I work for the Office of the Global AIDS Coordinator, which is basically the convening body, the coordinating body that's designated to head up the President's Emergency Plan for AIDS Relief, or PEPFAR. And so it's a very macro-level job. And I feel really thankful that, you know, for 10 years prior in my career, most of my work, I've actually been able to have faces and names and relationships with people, so that when I'm thinking about policy decisions, I can remember those faces and those names. And now I'm looking for what is it in Washington, D.C., or what is it in this community that I'm going to be able to engage in to keep my sort of heart tied in or reminded of why it is that I want to work in public health. And that may not be everyone's story, but for me it's made a huge difference. Because I find keeping that passion alive, it keeps me from being kind of consumed. In really dark situations, when you look at HIV/AIDS and the amount of money that it is, and often, you know, I'm embarrassed. I mean, I'm not on the record here. You can't. I'm embarrassed about the amount of money that we've put on HIV/AIDS. You know, in some ways, because there's a lot of other things out there that may be more effective. In fact, some of that money is difficult to spend, if we're honest, you know. And so I'm now working in that kind of wears on you, or whether you're in Darfur and there's a very intense political situation and there are security issues and everything else. So I find having my heart kind of centered and focused, both in relationships with other people, and then definitely just in being a person who remembers that Christ is the hope for this world. There are so many messes here. There are a lot of things that I'm not going to be able to figure out. I may be able to know some quick wins, you know. We know some good things about preventing mother-to-child transmission of HIV. We know some really good things about diarrhea, you know, using ORS or zinc. But we might not be able to figure out all the big, massive problems in the world, and yet there's hope, and there's hope in Christ. And I think those are the kinds of things that keep me focused. Amy.
Okay, my name is Amy Metzger. I have kind of a similar story to these two, but it's slightly different, so hopefully you'll appreciate it. It's a little convoluted, but I'll try to keep it as brief as possible. I actually did not become a believer until I was 29, so before getting out of college, I was going to do physical therapy. That didn't work out. I grew up Catholic. just by accident, I moved to Atlanta to take care of my sister's kids when she was having a bone marrow transplant, and just started looking at graduate programs. And I've worked in hospitals and nursing homes and physical therapy departments for years, from the time I was 15 until I was 25, even after college. So sometimes I talk to some of you and I'm like, gosh,
Amy, can you speak a little louder, please?
Sure, I'll try. So you're all so ambitious and so successful so far, and I feel like I sort of, I got out of college and had a biology degree and didn't know what I was going to do with it, but it's funny how God just takes you on these different paths through life and you don't. And my name is Amy, and people actually used to call me Aimless. This was kind of my nickname. A couple of people called me that at this hospital that I worked at. It was hard to know. I hadn't thought of that in a while. So I didn't even go overseas until I was 28, and I had a great opportunity. Just kind of fell into a great opportunity. Was going to Emory, but got a good opportunity with a guy from Johns Hopkins to do a malaria study in Uganda, and really worked out well. Did a lot of published from that, and had a very successful project there. Yeah, it was neat. I actually wasn't even stopped going to church at that point. I didn't even come to the Lord till after that. So I came back from Uganda, and my dad got sick, so I moved back to the Cincinnati area and took a job working for an organization doing child survival work in Haiti. And it was just neat that there's no really international public health jobs in Cincinnati, but it gave me the opportunity to use my degree and be close to home, and used that opportunity for a couple of years to learn a lot about public health, and had worked in Uganda doing a study, and so kind of a different thing, being the role of a health program director, which actually Paul Robinson was in before me. So kind of going from working at a hospital level in Uganda to being at the kind of a technical support, working on his child survival program. So I did that for a few years, 2 years, and just decided, I think the thing I want to encourage people when they pursue things is, if you're not happy, don't stay at a job that you're not happy with. Just it's not good to stay somewhere, just because, especially in this economy, I know people want to hold on to their jobs, but it's sometimes the Lord leads us away from great opportunities, and He opens other doors. So I left that job. Really just felt like it wasn't the right job for me, and I don't know that many people do this, but I do it a lot in my career. Just like people say, you should never should never leave a job without having another job, and I have faith the Lord is going to take me through this situation. So after that, I did some substitute teaching, did a lot of different things. I was still in the Cincinnati area, just trying to figure out what to do next, and then went back to Uganda, where I'd worked before, living out in rural Uganda, just as a volunteer, not really even raising much support. I just raised support to get there and to do get the things I needed. Did that for close to a year, and my sister, who had cancer, and my mom were both having health problems. My dad had died a few years before, so I really felt like I should get back and help support my mom. So I moved back to Kentucky. When I left for Uganda the second time when I lived there, people said, how long will you be there? I said, maybe years. And I didn't care. I wanted to get that experience of living out in rural Uganda and really learning, kind of a Peace Corps experience, because I hadn't done anything like that before. I kind of do things backwards.